partners at Wilcox Companies. And today we're talking about not only Wellness Partners, but more specifically Partners Health Alliance, one of our sister companies, and some of the valuable options we have to help you save money, specifically on prescriptions. So I'm going to be your hostess today, and Paul Jacobson, our registered pharmacist, will be chiming in with a lot of good advice and also be open to a Q&A for you if you have any questions. So let's go ahead and get started. So as you guys probably know that, we have a lot of healthcare costs that just keep rapidly escalating, and Partners Health Alliance is here to help control some of those costs. Because of the way that the NBA Health Plan is structured, we are able to do some creative things to help control those costs. So if you feel like you're out of control or you don't have control, we're here to help and show you some ways that you do have control. And one of them is with pharmacy spending. All right, so let's talk about high-cost drugs for a little bit. Most prescription drugs available as generic products are normally pretty reasonably priced, or your copay is pretty low, and you can afford those. But the ones that we see on TV are typically the high-cost drugs or the problem drugs. And I'm going to let Paul launch into that a little bit. Paul, why don't you tell us a little bit about why we see those on TV and why they cost so much?
Thank you, Laura. Yes, one of the reasons, why a new product that hits the market is so expensive. There is a lot of money spent on research for the product. These products are very expensive. They're life-changing, and there is a high cost involved. Plus, when a manufacturer that produces a fair amount of medication or new innovative products, really 8 out of 10 never make it to the market. So there is a cost recovery system involved. The sad part about that is that they normally recover that research cost in the first 6 months of marketing it. And you can see here on this slide what I can't call these the average costs, but these were they're pretty typical costs for some of the products that you're probably familiar with through commercials. One of the things that we do with these high-priced products is that we contract with our Canadian pharmacy partner, and the price differences between the Canadian pharmacy and the United States pharmacy is significant. For the main reason is that I tell people the Canadian government, but really all other governments, negotiate prescription drug prices with the drug manufacturers. The United States chooses not to do so, and there's 100 stories behind that, which we won't get into, of course. But here are just some examples. The Farxiga, $765, but like an average price for a month's supply. Through Canada, and I'm rounding these numbers up, it's $110. Januvia, very similar, $550, about $120 for a month's supply. With the Jardiance, $605 through GoodRx, and just under $100 for the United States. I'm sorry for Ubicare or Canada. Zigduo, very similar, about $100 a month as opposed to $582. Ozempic, and actually just had a call on this after you and I talked yesterday, Laura. I had to do a price or cost override on a prescription there, and they were submitting a price for $1,150 on the Ozempic. We import that for under $300. Trulicity over $900 through Canada, just under $400. And I can't emphasize this enough, but these are not generic equivalents. These are not some third world product. These products are manufactured all in the same spot. They would not be some sub-therapeutic or anything like that. So these are brand name products. The only difference you might see on some of the supportive labeling is that you may have a part of that being in French because it's Canada. And why Canada? Well, they're close. We could be importing these from Australia or Great Britain or France, but Canada's closer. And a lot of times, I do get questions, why Canada? And perhaps the better question is, why not us? But you can see just through those examples, vast differences in cost. And so when you look at the total picture, if we can reduce or eliminate your out-of-pocket expense and then reduce the expense to your health plan, I mean, it's just a win-win for everybody. And we have a lot of people participating in this, and it's been a very well received. So.
Yeah, I'd call Paul the Santa Claus of Partners Health Alliance because he gets to deliver good news most of the time and help put money back in people's pockets. So we're happy to be able to do this. And we're just here today to tell you guys about this as an opportunity in case you weren't aware of it, and that you can start conversations with Paul or myself to figure out how to help control your spending. Okay, Paul, so next we have the copay conundrum, or the copay coupons. Why don't you walk us through how those work and what are some of the positive and negatives of the coupons?
Well, again, the positive is that as you walk out of your pharmacy, you will have either a zero copay or a reduced copay. So the out-of-pocket expense to you is less. The disadvantage is that the savings, the copay costs actually are ultimately passed on through higher prices, which occur every 4 to 6 months. I did a continuing education program here about 3 months ago, and they dealt into the specifics of how this works. And long story short is that they just, they track all the coupons, the value of the coupons, follow studies as far as what are the trends, and they will incorporate the money lost on the coupons and incorporate that into the next price increase. Generally, price increases occur every 12 months on these new products. More expensive ones that are approaching $1,000 a month now we see that every 4 to 6 months, and we'll see a solid 10% increase or more. So these are significant increases. And then there are the times where actually they'll change drug therapies because of the copay card, and that's just not right. If you need a change in therapy, that of course can happen, but do it strictly for the money. I believe that's ethically wrong, and it doesn't happen often, but it has occurred. There were several cases in the study that I participated in that highlighted that. So again, the coupons have a little bit of a value, or do have obviously some value, but the long-term effects of it really aren't that beneficial, and you end up paying for it one way or the other because you do indeed pay your health insurance premiums. Generally, they increase each year, so that is a big part of that.
Yeah, and just to chime in on why Partners Health Alliance cares about your prescriptions. Number one, we're here to help people improve their health and reduce their spending. And when we can help your plan, and specifically your VEBA plan, take care, help control some of these massive cost medications, you all should benefit in either a lesser increase annually or even possibly a stabilized premiums. So that's just one of the ways that Partners Health Alliance can help impact your spending as a pool if you guys can all work together to utilize some of these services. Okay, Paul, so now you want to walk us through kind of an example of how a copay card can function and why it might be changed, et cetera, right?
Of course, Laura, yes. This is actually, I've seen this example many times in my practices over the decades. But with this example, you have someone with type 2 diabetes, they're well managed, they're not really having any problems. A1C is at desired level, side effect profile is negative. but you don't really like the $20 a month copay. And even if a mail order is going to be $40 to $60 to cover the cost, so you just don't like that. Um, so you talk to your provider and think, boy, maybe I can get it changed to something. And so what do? They'll prescribe an item that's more likely 9 to 10 times the price, but there's a copay coupon. And of course, I trust the provider won't just change it indiscriminately. There'll be some science behind it, of course. We pray for that. But still, on the money side of it, now your charge to your health plan, again, but which you pay for, will be nearly $1,000 a month, as opposed to more likely around $100 a month. And you just do the math, that cost difference times 12, there's your annual fee. It just, money-wise, it's just not a wise thing to do. Plus, these products, as innovative as they are and as good as they are, may not be necessary. If you're getting well managed and maintained, and you're doing fine with a one product, chances are you don't need an Ozempic, which is a much more powerful agent to decrease your blood sugar, blood glucose than say a metformin or some of the other products. It just is more potent, and we see people that go with a once a week injectable product. Again, that's convenient too, and you see the episodes of hypoglycemia where the blood sugar just drops. And it's just that these are strong medications that have strong effects, and they have a significant side effect profile. If this is where your healthcare situation takes you, well, that's what the medication's for. If you're not well managed, A1C is in double digits, things aren't working. These are really the last resort at this time medication list. This is not something you start out with. And again, on the dollar side, well, you've seen examples of the cost difference. So you're changing your medication to change to save $20 a month, and you've just opened a Pandora's box of potential, and you're going to have some type of side effect profile. It may not be significant, but still, this has occurred, and it truly was not there to benefit your health status. Again, if your health profile takes you there, then that's what it's there for. But none of these products you see advertised on TV should be started just because, well, gee, my blood sugar's been a little high the last couple of times I've checked it. Okay, let's do Ozempic or Trulicity or something like that. These are not first step products, but with a $0 copay card, unfortunately, sometimes they become a first step product. So again, on the cost side, it just becomes an unnecessary expense, and health-wise, it's just not a good idea.
So just to reiterate, Paul, you're saying that sometimes you understand drugs do have to be changed because they become ineffective or your condition changes.
Correct.
You're just encouraging people not to lightly step into these without considering all the side effects, especially knowing there's going to be a financial component as well.
Exactly.
Which is the next point here, that you might for a while save money, but then eventually it catches up and your copay is going to end up higher. Is that right?
Exactly. Copay, the copay cards do expire. They do run out. I'm not saying they might find it or help you in another way, but again, the charge to your plan does not decrease at all. In fact, it will increase. Again, the Ozempic from under almost $200 a month, actually $200 a month increase. That's in 1 year. Actually, in November it was under 1,000. Now it's just under 1,200. So, and they can get by with it. It is they still have their patent, and it will continue to go up. But again, you have the promotions, and just an idea with the advertising. Back when Claritin went from prescription to non-prescription, sharing corporation, which makes Claritin, spent more money on its advertising than Coca-Cola spent on Coca-Cola. So
Wow.
these, I mean, there's a lot of money being spent on these products, and also the companies spend a lot of money on Congress. And we won't get into that here, but it is part of why these things are so expensive in the United States.
Okay. And so again, you're just encouraging people to really consider all the factors, financial and side effects, and work with their healthcare team to make sure that it's a really informed decision.
Exactly.
Yeah. Okay. So now, and feel free guys to chime in the chat. I know you're all muted, but if you have a question, go ahead and send it over in chat and I'll pose it to Paul here. We will take time at the end to chat with him as well. But next we're going to talk about preferred versus non-preferred drugs and what that means. So Paul, if you don't mind real quick, just kind of catching us up on the definitions here of preferred versus non-preferred before we go into the deeper parts of it.
Certainly. Again, the preferred drugs are probably the ones you're familiar with. I'll use an example of a drug class, things for acid reflux. Let's just go with the Pepcid and Zantac option items. Those were they were on about everybody's preferred drug list. They're inexpensive, they're generics now, of course, and very effective, and they probably take care of 99% of the issues that products such as that would be needed for. But there are a couple other products out there that are slightly more effective, little less side effect profile, but rarely used. They're just not big names, and they are more expensive. So those will get shifted to a non-preferred status, where the preferred drugs, again, really cover 95 to 99% of a drug class, be it an antihypertensive, be it a cardiac drug, be it a medication for acid reflux, etc. Again, and the non-preferred, again, are the other ones that may have a little bit different benefit. And I guess the example I have for one, there's a product called nicardipine. It's a calcium channel blocker, which there are a dozen products in that drug class you primarily use for hypertension. But most of the drugs in that class, and again, most of the drugs in that class will not only lower your blood pressure, but they can also decrease your heart rate. It's just how the drug works. But there are some cases where people with high blood pressure have a low heart rate, so we don't want to decrease the heart rate anymore. So this nicardipine actually is about the only drug in that class where it actually increases the heart rate. But usually we don't want that. So that would be an example of a non-preferred drug because it's not used very much, and the need for the product and its special benefits are quite low. So they'll just knock that one out, and it is more expensive than the other ones. So you have that. And again, the determinations of what's preferred, non-preferred, is that you have a lot of medical people working with insurance companies and other medical groups to determine really what should be on what list, and a lot of thought goes into it. But the non-preferred are more expensive, and you will have a higher copay on it, but it will still be significantly less than paying the entire cost of the product. So I don't want you to think that it's certainly not worth the cost, because everyone's health condition is unique to themselves.
So if someone is on a non-preferred drug, they're most likely paying more money, correct?
Correct.
Do you encourage them to have a discussion with their healthcare provider about moving, or do you believe they're probably in the right spot already and just need to stay there on that particular prescription?
I'm hoping that they are in the right spot.
Okay.
Because there's a reason why they chose that over what they chose or choose for, again, 9 out of 10 patients.
Mm-hmm.
I don't like to see providers make drug prescribing decisions totally based on price. I think it has to be you have to consider it because one, of course, if you can't afford it, you can't take it. So,
Right.
but it's not the sole determining factor. And but always have that discussion with your provider. Every time you see them, I hate to say challenge them, but find out what what your needs truly are. So
Yeah.
but again, on this slide again, you see there the negotiations will occur because the drug manufacturers do want their product to be uh, in that preferred group, and sometimes contracts will be drawn up and to lower the price to get them into that preferred group. So we have several classes where every product in that class is a preferred drug simply because of the contracts. So
Okay, great. If anyone has any questions, feel free to send them in the chat. And we're going to move along now into a little bit more specifically of how and why Partners Health Alliance and Paul can be of help to you. So again, like I mentioned, because of the way your plan is designed and because of the way that PHA functions, we are able to help negotiate or find alternative methods to receive your prescriptions. Paul mentioned Canada, of course, and he already explained why we choose Canada right now. It is legal to do that. Don't let someone tell you that that if we do that, that is an illegal practice. So I just want to put anybody's mind at ease in this case, that we're not breaking the law by helping you source your drugs differently. And again, we also can help depending on the type of plan setup and the type of possibly patient assistance available. Your out-of-pocket cost can go down to zero or it can be reduced. So again, there's just too many variables there to promise you in this case. So I would encourage you to talk to Paul about getting some estimates potentially of what he could help with. And again, his name is listed here, Paul Jacobson. I'll provide his email in a moment. Paul, do you have anything you want to fill in there about how and why you can help, or potentially a couple, maybe stories of how you've helped people?
sure, I can. We had a person who they came with us, I believe it was July 1 of last year. Her and her husband, both diabetic, both using Ozempic. I believe they had something like 14 or 15 products that between the two of them that they took. And with her old plan, they were spending between $500 and $600 a month on copays. And with our program, and again with our zero copay on the maintenance medications, plus the importing from Canada, their monthly cost went to zero. And now that's probably an extreme case, but I've heard of so many others because of a different plan that we have there. We have such a large zero copay list, and then you take out the exorbitant cost on these newer items. I mean, it changes their lifestyle. It just one of those rewarding things. Sometimes I do feel like Santa Claus. I've had phone calls, people are crying, a good cry, and the emails are so kind, and we really try to do the right thing. And I believe that's one of the things I enjoy so much working with Laura and the group is that the intention here is to do the right thing. If we can save money and for the patient, that's so much, because patient non-compliance is just still a large, one of the top reasons why people get admitted to the hospital. Spent 15 years working in hospital pharmacy, and I read the input and hasn't taken insulin for 3 days, haven't done this, ran out of medication last week, and now they're in for the hypertensive crisis. I mean, it happens. So if you can't afford it, you won't take it. And again, it changes. It's a life changer for a lot of people. I've been told that many times, and it's the right thing to do, and we're making the effort.
Yeah, and just Sorry, just to back up what Paul's saying, our sister company, Wellness Partners, who does your screenings, which I'll talk about it again in a little bit, the nurses do back up what Paul is saying about people are saying, well, I couldn't afford my medications this month, therefore I'm not taking it. That is why certain things are out of control. So it is a real problem we see on the nursing side, and Paul has experienced it in his history as well. So we never want people to be in that position. And that's one of the reasons that Partners Health Alliance has such a robust RX program, is because we want to see people getting the care they need, but within, being able to afford it. And especially, like Paul said, being able to free up potentially thousands of dollars a year for certain people. And of course, with the inflation happening, we need to see that even more, that we hate to see people reducing their care to buy groceries, et cetera. So I suspect Paul will be getting even more phone calls and emails soon about ways we can help impact costs. Now, we do want to talk about the fact that we know right now we're talking to our, NBA audience, and that you guys have local banks in local communities where there's a local pharmacy. And so just for a moment, I'm going to have Paul just touch on that aspect, in case that's a concern of yours, if you're afraid of, if you use PHA, that you're going to potentially damage your local pharmacy's bottom line. So Paul, do you mind just real quick touching on a few of your knowledge points there?
Certainly. And I've been a licensed pharmacist for longer than I care to admit, but it's been many decades. And so I know what my first 30 years were in retail pharmacy. So I was that guy in the small town, or the guy on the corner in the corner pharmacy. And this first point here, the retail pharmacies just don't have the profit on the prescription items that they used to. An example, my last retail position, we had 4 full-time pharmacists, 2 part-time pharmacists filling about 300 prescriptions a day. A friend of mine who left a hospital physician or position went to work for Walgreens. He works a 12-hour shift. He's the only pharmacist, has several technicians, and they fill between 1,200 and 1,500 a day. So, and they have to do that because of the impact. The dispensing fees just aren't what they used to be, and that's why you'll see the pharmacies having weight loss clinics. They'll be doing vaccinations. They'll have a diabetes program, and they're doing a lot of things that become very creative to stay open. And I've had, when I worked for a chain pharmacy, I had people in power saying that the pharmacy has really become just a draw. We're not making the money there, but we do on these other services. Therefore, we want to keep you here. But again, the profit margin, if you were to say, get your Ozempic once a month from your local person, and now you're going to switch it to us, the financial impact to your pharmacist is probably under $5, $10 perhaps. Last contract I negotiated, I didn't negotiate. I was involved after the negotiations. Our dispensing fee was $1.93 per prescription. That's what we made on the dispensing side. If we bought it right, got lucky there, then we could make a little more. But again, going with this program, we're impacting just a very low number of prescriptions. If you were to have your pharmacist pull up what are the top 100 drugs that you dispense, you're not going to find any of these products on. Well, you might, but it'll be towards the lower end of that list of 100, top 100. These are not the highest or most dispensed products. And again, if they'll make more money on a generic than they will on one of these brand name products. So you're not really hurting them. Again, I've been that guy in that store, and back in the day, a lot of people go down to Mexico for their medications, and but they'd come back after their winter vacation, and they'd have a box full of products, and they were the same brand name products that I was dispensing, and the whole great big moving box cost them $11. Well, one packet I would have charged them over 20, so they saved hundreds and hundreds of dollars. So how can I, as the pharmacists go, well, don't. So we're just not, we're not going to run anybody out of business. And of course, obviously, that's not the intent. But I come from a banking family, and I know that Main Street wants a good bank, and a bank wants a good Main Street. And we would not be taking that away. We are not taking that away. So I just want you to know that.
Yeah, thanks, Paul. Yeah, just that is important to us. Just but it's been brought up. That's why we're addressing it. But we want you to know that we do care. And Paul's unique background, with banking history and pharmacy, he's very qualified to help speak to that topic. So if you have any further discussion you want to hold later with him about that, I'm sure he'd be open to those conversations. All right, and then I just want to kind of end the last couple slides here with a few more just tips overall on being an informed pill consumer. And I'll let Paul explain these here, but these are kind of his top 3 tips for you at the moment.
Right. Thank you, Laura. These are the issues that I guess when people come to me for advice on what to do. This is about what it comes down to. And take your medications correctly. Don't skip days if you're taking them twice a day. Make sure is it with meals, without meals, with food, without food, because it does make a difference. And consistency is very important. You take it every day if you're going to take it every day with food, we'll take it every day with food. Don't do the empty stomach one day and with food the next. It does affect the blood levels. So, but taking it consistently is very, very important. Again, as I mentioned earlier, it is a leading cause of hospital admissions, and it's very much avoidable. And ask questions. Hold your healthcare team accountable. Don't be a jerk about it, but challenge them a little bit. Do I really need this? Is there a better alternative? Providers want you happy and healthy. They don't want you to become their problem child. They really don't want to. They want everyone to leave happy and healthier. So ask the questions. Talk to your pharmacist. Talk to the nurses. Make sure the provider takes the time that you require. And then be financially responsible. For as much success we've had with this program, I still get the people that we just had a situation where the product was almost $4,000 a month, and through Canada it was a little over $1,000. So say $3,000 a month difference, $36,000 to your health plan. And the person said, well, I've met my I just want to get it here, and I'm just not going to deal with getting it mailed. So thank you, bye. And that it just, to me, that is I can see the point, but the cost of healthcare can be managed better than it is being managed now. There are options. You can do things. This is in my retail days, the cost of medication was brought up more than the side effect of the medication or the condition that the medication was supposed to fix. It's always been a money thing, and we actually can do a lot about it. And we are doing it. We are making a difference. We are changing people's lives for the better. And it's an honor to be part of it. And as Laura said, that whenever you start importing something, there's going to be a question. There's going to be someone that doesn't like it. Misinformation is abundant everywhere. And it's touched this a little bit too. But it is your pharmacy cannot order their medication from Canada or internationally. That is against the law, but we can do it in the role that we play with this. So it is cleared, it is legal, there is no problem there, and it just really helps people be more compliant with their medication, again, which goes back to point number 1, because that is really as important as any of them, perhaps more, because if you don't take it, you're not going to benefit. So, but rambled on enough about that.
That's Great. No, thank you, Paul. Okay, so we're about done here. I just want to remind you guys, especially if you joined us later, I just want to kind of bring in full circle again the services we have for you. So Wellness Partners, hopefully you're familiar with our name. We are the company that provides your on-site screenings. We're the ones that provide the nursing calls, the lab work, the monthly newsletters, the quarterly magazines, the challenges. So I just want to encourage you to read those newsletters, sign up, send me an email. You can email here this address, healthyliving@wellness-partners.org. If you're not familiar with the services I'm discussing. And then we also have these amazing professional specialists available to you, and we don't limit your conversations with them. So of course we have Paul here in the middle, and Paul technically works for the sister company PHA. So that's why his address is pjacobson@partnershealthalliance.org. And then on either side, we have our exercise physiologist, Ashley. She's provided some webinars in the past for us. If you want help with exercising, stretching, training for an event, she's available to you, akringle@wellness-partners.org. And then Marty Seabrant, our registered dietitian. Marty's also amazing at helping you adapt your lifestyle, your desires, your goals, what you like and don't like, into a healthier way of living. So again, I encourage you to reach out to her. She's done some excellent webinars for us in the past as well. Again, her email is mseabrant@wellness-partners.org. And remember that you have a unique opportunity here to utilize these specialists together. You know, Paul can help you on your medications. Marty and Ashley can help you monitor or adjust your lifestyle to help keep those medications, you know, like Paul said, you don't have to add more and more and more on potentially, but that you can use this as a team to help impact your costs and your lifestyle. So thank you so much for joining us today. We are just going to sit here for a moment and wait for any Q&A to come in. I get this can be different because there's a lot of potential discussion of PHI and drugs. And so if you don't want to say that, no worries. I encourage you again to utilize Paul's email address. Again, if you're sending PHI, send it in an encrypted format or call our phone number and we can schedule a phone call with Paul as well. I